Welcome back to Starting with IEP. I am Flor de Amelia, IEP coach, special educator, BCBA, and a mom walking this journey right alongside you. Today's episode is one that so many families need. We are diving deep into one of the most misunderstood parts of the IEP process: eligibility. Some of the questions that we're going to be reviewing is, what does it really mean to qualify for special education? Why doesn't a medical diagnosis automatically equal an IEP? What is the two-prong test under IDEA? How do cognitive scores, academic data, adaptive skills, and social emotional ratings actually interact when the team makes a decision? And what happens when grades do look fine, but you know that something isn't right? To help us unpack all of this, I am joined by Dr. Mathews, a licensed psychologist and nationally certified school psychologist with 15 years of experience in the public schools across Pennsylvania and Delaware. She brings such clarity to topics that often feel overwhelming and intimidating for families. This conversation is honest, practical, and incredibly empowering. We talk about the difference between diagnosis and educational impact, reevaluations and why scores don't always tell the full story, certificate track versus a diploma track considerations, transition planning and adult services, the most misunderstood eligibility categories, and how teams interpret data behind closed doors. If you have ever walked into an eligibility meeting feeling confused, anxious, or unheard, this episode is for you. Before you jump in, please make sure that you follow the podcast, share this episode with another parent who needs clarity, leave a comment, and tell us your biggest takeaway. Don't forget to visit us at www.startingwithiep.com, where you're going to find our free resources, parent guides, our digital courses, our workbooks, tools to help you walk into your next IEP meeting feeling confident and prepared. So, all right, let's get started. Thank you so much for joining us and sharing all of your knowledge. I was wondering with everyone else, can you please share about yourself? Please tell us your background. Tell us more about yourself, because I'm excited, but I feel like I wouldn't do you justice explaining everything.
Sure. Hi, I'm Marielle Mathews. I'm a licensed psychologist in Pennsylvania and Delaware. I am a school psychologist as well, and have credentials both in Delaware and Pennsylvania, and I'm nationally certified. I've been working in a school for 15 years, and I'm transitioning to the outpatient therapy world. So the things that I share today is going to be based on my experience in a school. So if you need to consult with an attorney, I just want to recognize for parents that this isn't legal information that I'm sharing. If you need to consult with an attorney, this information that we're going to talk about today is just based on my own experience working in the school for the last 15 years.
Thank you so much. I think before being in this field, to say that I have a psychologist that I can just talk to and ask questions and pick their brain, I think it's just hard to do. So I think that I see this more like picking her brain, like the daily life of a psychologist, or what you see. I think it's just really hard for parents to understand and to see it through your lens. Right.
Sure.
So I'm excited for parents to see that.
Yes.
So with our first question would be, it's mostly about the foundations of eligibility. So from a school psychologist perspective, what does IEP eligibility actually mean beyond simply having a diagnosis?
So that's a great question. A lot of parents come into the school with some sort of diagnosis for their child, whether it be from the pediatrician or from an outpatient psychologist. And so there is a big difference between having a diagnosis and being eligible for what we call an IEP or eligible for special education services. So there is a big difference, because not only do you need to have, let's say, potentially a diagnosis, you actually don't even need to have a diagnosis to be eligible for special education. But let's say a parent comes in with a medical diagnosis of some sort. Let's just, for ease of conversation, we'll say attention deficit hyperactivity disorder. And the real eligibility of special education comes in when that ADHD impacts the student's learning negatively. Okay. And so that's where we determine, based on all of the evaluation data that we collect, if the child with a diagnosis is eligible for special education services.
That was beautifully put. That was so beautifully put. But can I ask for a teacher? Because let's say for a teacher that is very well seasoned,
Mhm.
she can handle her classroom and she can definitely teach. So it's more like the teacher's able to multitask and definitely help the child in need. But let's say a newer teacher is in the classroom, same student, right? But just a newer teacher with less experience and may not be able to have so much classroom management experience. Then you can see how the child with ADHD may need more support and it is impacting the child.
Right. And I think that's an important part to make because as part of a comprehensive evaluation, the teacher's input is going to be one piece of that whole evaluation. Getting that information from the teacher and being able as a psychologist to come in and observe the student within the classroom environment is going to weigh heavily, and we'll be able to make that determination. Is the ADHD impacting the child because of the environment? Do the environmental supports need to be boosted, or is it not? And we'll talk later about the components of the evaluation. So I think the teacher and the environment is just one part of that. And as psychologists, when we come in to observe students, we're looking to see what are the factors that might be contributing to the difficulties.
Thank you so much for that. I like how you said it was only a one part factor of it.
Yeah.
But often I always tell parents, if your gut is telling you, just ask for it again the following year. Just make sure that they know about it. So
Yes. Yeah.
yes. For the next one, families often assume a medical diagnosis automatically qualifies a child for an IEP, which I know that you just covered. But why is this not how eligibility works under IDEA?
Okay, so I wanted to give you a little bit of an example, maybe that would help us to understand, sort of the nuances behind some of this. So let's just say a child has a medical diagnosis of diabetes. Okay, so there are certain situations where a child with diabetes, their medication might be managing their diabetes and it doesn't impact their educational progress, right? It's all medically managed. On other instances, a child with maybe the same diagnosis might have an educational impact. For example, needing the nurse to help administer medication during the day, or educationally missing multiple days of school, longer periods of time, or if the diabetes is so severe that the child needs to have additional services in the home, let's say. So you can see from the example where just one medical diagnosis can really be not impacting education or fully impacting education. And it depends on each of the situation.
Yes, I love your examples. Also, another one would be when a student has seizures. Some of them can be managed and controlled by medication, and then some other cases, it can be for anti-seizure meds, and they're still having daily seizures or seizures enough that's impacting because they can't retain that information. So I definitely see it when it goes other health impairments.
Exactly. And that's part of the evaluation process, is to see, is the diagnosis or is the impact there educationally? And that's really the important piece of the evaluation in the school.
Well, thank you so much. I love examples, and I love it when families hear examples because then they can learn from them. So thank you.
Yes, exactly.
Yes. The next one is, can you please walk us through two-prong tests for eligibility, presence of a disability, and educational impact?
Great. Yeah, so we're answering two questions when we do evaluations in the school setting. The first, is the child eligible under the different classifications in IDEA? So those would be your 13 disability categories, such as we talked today about other health impairments already. So when a child has a medical diagnosis that negatively impacts their academic performance, could be a number of things. Oftentimes, it's ADHD or anxiety could be under that umbrella as well. Another very common classification under IDEA that I see most often is a specific learning disability. And this specific learning disability classification includes things like dyslexia, difficulties with reading, writing, math skills. We look at that as potential eligibility under IDEA. And then I'd say another one that I see most commonly, so other health impairment, specific learning disability, I guess I would say is looking at, and just because I work generally in secondary schools the last 8 years of my career, another classification we look at is what's called an emotional disability, or depending on the state, they may call it emotional disturbance. And so that's for students who may have a psychological diagnosis that impacts their academic performance as well.
What type of psychological diagnoses would be under that?
It could be a variety of things, maybe things like depression. Anxiety can be under this emotional disability, and things like disruptive mood dysregulation disorder, that could also be potentially under that classification. That's the first part of the eligibility question is the student displaying any of the criteria of any one of the 13 disability categories? And then the second question is, does the student need what we call specially designed instruction or special education services? And so that's where we really look at the data to see, is the disability that the child has impacting them to the level that would require specially designed instruction. Wow. So that's like more individualized instruction than a regular education classroom.
I love how you're explaining each of those, because a lot of the times the families just have a really hard time. Their anxiety levels will go up because it's like, you're giving me a lot of information, but you use very parent-friendly language.
I do try. I think what's difficult for parents to understand is there's this whole world of educational law that maybe they're not familiar with. So they might come into the school with the feeling of, I need help for my child, and then realize there's so many little nuances that they have to understand throughout the process. So I do try my best to just put it in terms that are understandable for anybody that maybe it doesn't have a background in education.
Thank you so much for it, because I think as families are listening, they'll be like, I didn't think about it that way. Now that makes sense.
Yeah, yes.
But before I forget, where would schizophrenia be then?
I think actually, and I got to look back at the actual definition, I think it includes schizophrenia. And then in emotional disability, we have to rule some factors out. I think then under the classification of emotional disability, schizophrenia is actually included.
Yeah, I remember when you said that. Doesn't that also occur with intellectual disability? So I think they have to disprove with something, and I think also with traumatic brain injury.
Yeah, so there's very specific guidelines for each of the categories, and then some of them are really general too. So, for example, emotional disability, the terms or the definition is really kind of broad and left up to interpretation, and just the term emotional disturbance, I think, has a very negative connotation for families to accept the thought that their child might be disturbed in some way. So I prefer to use the term emotional disability, and depending on the state where you are, they will use that term, or the federal term is emotional disturbance.
Okay. Thank you for all of that.
Yeah.
So our next question is, this is actually a good one. What are the most common misunderstandings families have about eligibility when they walk into their first IEP meeting?
Okay, so I think probably the hardest part for parents, and correct me if I'm wrong, because I think you probably know this very well, and I'm on the other side of the table, but putting myself into the parent's shoes, I think the vulnerable conversation is difficult to have, right? So you've already acknowledged that your child's not making academic progress. You have to understand these whole new subsets of educational law. You have disclosed plenty of information during the evaluation, maybe about your family, maybe about how your child feels. So being in a vulnerable situation like that, I think any parent would be really nervous. And that's definitely understandable. Oftentimes, when a family is coming in for their first meeting, I will have already had plenty of discussions with the family before that meeting. And the purpose really is to try to walk them through the process so that they feel comfortable coming into that initial meeting. So their first IEP meeting, they may have already know about the eligibility, and some schools do the eligibility meeting first and then take time to do the IEP meeting after 30 days or so. And some school districts like to do those meetings together. So you'll have the eligibility meeting and then you'll run right into the IEP meeting. So I think what's important for the parents is to have somebody at the school that can walk them through the process. And also, I think what's important is that they need to educate themselves as much as possible to understand truly what the educational disabilities are, what process did my child go through, and what other things can maybe the school district provide to support my child. I can imagine that it would be difficult to come into a room full of professionals and you be the parent. But I think what's important to remember is, and I say this to all my parents, you know your child best.
Mm-hmm.
Now, we've known your child for a few years, but you know your child the best. So it's important that they understand too that they're part of that whole process too. They're an integral part of the entire IEP process because they are the experts in knowing their child. So those are some things that parents might know, but maybe there's other things that I don't know.
Thank you. Yes, I think you said it so beautifully. I think my experience was a little bit different because at 14 months, they told my daughter that she has infantile spasms. And then they told me the prognosis of what it can look like. And then at 18 months, they told me moderately to severely mental retardation. At that time, that's what it was called. Now it's intellectual disability. It was like a huge gut punch there.
Absolutely.
And then it was autism at age 2. And then as the year goes, we get new, different additional diagnoses. But when I talk to other families, and I remember once I talked to a self-advocate and he described himself as damaged goods because that's what his dad basically described. He was the only male in the family. So he was supposed to help bringing income to the family. And his dad just said, basically called him damaged goods. And now his dad has to live on forever to help with the family. But he said his dad thinks of that because he graduated. He has a high school diploma, but he received special education. So his dad will forever see him as that, even though now he is actually successful, but his dad sees him through a different lens. So I think that's a misunderstanding that a lot of families I'm seeing, maybe they don't want to tell other people that it's like taboo. Like people don't like to say that they have seizures. It's just something that people don't talk about. So I say it's similar when it comes to special education. It's something that people do not talk about, but there's successful people out there that have received special education and they're making a nice living out there.
Yes. Yeah. And I always say that too. It's like, it's important to normalize it in a sense that just because potentially your child has a learning disability, or let's say ADHD, seizure disorder, just because they have a diagnosis doesn't mean that hinders their progress later on in life, right? We make a diagnosis because we then know how we're going to treat the condition. So that's why we make the diagnosis, not to identify people and with the thought of displacing them into another classroom or something along those lines.
Yeah, thank you. Those evaluation meetings, those are hard.
They are.
And I could picture you in the conference room where wherever they have their meeting. And I love how you have these discussions way before the IEP meeting. You said you have several discussions with the family. So the environment for that family must be very positive, or at least they know they have someone friendly in the room.
Yeah. What people don't realize about school psychologists, because they're employees of the school, but ethically, we have an obligation equally to the school and to the families that we serve. So we are in this interesting position where, of course, we're employed by the school district, but we're also ethically inclined to support families. I really do try to practice with that intentionally to make sure that the families feel like we can have a cohesive discussion together. I'm always trying to do that, even in my private practice where I work now. Oftentimes when I go into a school, I'm employed by the parents to evaluate their child, and I go into a school, I sense from the staff at the school this nervous tension. And I think that's something I'm really trying to change in my practice is we need to know what's going on. We're going to do a thorough evaluation, and it's not a gotcha moment. It's not a time where it's going to be contentious per se. The last thing that I want is a contentious situation. So I really do try to collaborate, reduce any stress that the school and the parents may have about this. And I think the consistent communication along the way is what really helps to reduce that conflict.
Oh, yes. So do you often go with your practice? Because you said you work for the school, but do you also have your private practice?
Yes. Yeah. So I worked 15 years in the school, and yesterday was my last day working in the school. So I'm now 100% private practice.
Philadelphia or Delaware?
It's Delaware County. Yeah.
Sorry.
Delaware
When you said
County,
Delaware, I'm like
Pennsylvania.
thinking.
Yep,
Okay.
but I'm certified as a school psychologist and licensed psychologist in Pennsylvania and Delaware. So I can do evaluations in both of those states, which is great. There's differences in how we evaluate in each of those states, even though they're right next to each other. So when I did my schooling and I started as a school psychologist in Pennsylvania, and then I went to Delaware, and I just realized there's a whole new set of rules that I had to learn. There's certain things within that state that they want you to do. And in Pennsylvania, we often determine eligibility before the team meeting. In Delaware, the regulation says you have to discuss it as a team. So interestingly, and I don't know how it is in Maryland, but in Pennsylvania, when we talk about the report and things like the determining eligibility, that's done by the psychologist in Pennsylvania. In Delaware, eligibility determination by law is the team. So that's why we have two different meetings in Delaware. We first have the eligibility meeting, and we go over the evaluation results, and then we talk about what we think the child might be eligible for. And generally the psychologist will lead that discussion because that's our expertise area. And then if the child's eligible, we schedule another meeting for the IEP 30 days out. So we don't predetermine eligibility. But it is interesting from state to state how the guidelines are interpreted. And then we have a federal regulation. And then depending on what state you're in will be determine sort of how you practice.
Oh, wow. Yeah. And it's right next door to each other. They're neighbors.
And it's crossing state lines. I had to really learn a whole new set of skills.
Oh, wow. Yes. So I guess this would go tied to the next question about evaluation data and decision making, which then I guess it would have to be like, which hat are you wearing? You're wearing Delaware, or are you wearing Pennsylvania's hat?
That is so true. It is so true. Not only the forms are all different, the evaluation forms, that helps, I think, a little bit be able to be like, okay, here I am in Pennsylvania, I'm doing it this way. And then here I am in Delaware, and I'm going to write the report differently in two different states.
Yes. I'm glad that they have that layout at least for you.
Yes.
But when eligibility is being determined, what types of assessment data carry the most weight in school-based decisions?
So this is a great question. I think there's not just one assessment that would drive determination and decisions. So we really have to, as an IEP team or eligibility team, we have to look at comprehensive set of data and then weigh different factors depending on the situation. There is a framework that generally we work under. So there's different areas that we definitely look at, but we're not just using one piece of information to make the determination. For instance, let's say a child has a medical diagnosis of autism, and the family brings that medical diagnosis into the school setting, shares it with the school. We open an evaluation to determine eligibility under IDEA to determine if the child meets criteria of autism educationally, and also to determine if it impacts their academic performance. And so we're not just looking on that one piece of information that the parent had the child diagnosed with autism outside of the school setting. We're also doing a more comprehensive evaluation where we're looking at different factors within the school setting to ensure that we're looking at it from all different types of lenses and making sure we're getting the best, most available data to determine that eligibility.
But does one have more weight than the other? Like the cognitive test, would that have more weight than the teacher's input?
So I think just based on the reason for the referral is there's going to be different weight set on different assessments. So for example, if we're looking at intellectual disability, we are going to be weighing heavily on that cognitive abilities because that's part of the disability criteria, right? It needs to be at a certain number in order to determine eligibility under intellectual disability. The same sort of goes for specific learning disability. We need those cognitive scores to determine if the child is performing consistent with what we would call specific learning disability. So I would say it depends on the reason for a referral. The weight of the cognitive is important for specific criteria. I would say for emotional disability, maybe we don't weight as much on the cognitive assessment. So again, just depends on what we're looking at.
Thank you. I don't think anyone has explained it. I'm telling you, you have a really good gift to explain this for parents, and you make it in a very easy language that can be very accessible to families. So thank you for that.
Good. I'm glad. That's helpful for me. I think it's important to give this information to families. And if I can give it to them in an easily accessible way, that's exactly what I want to do.
Oh, yeah. Very easeable. I just made up a word, easeable.
There you
Very
go.
Easy. Yes. Oh, wow. So how do cognitive, academic, behavioral, and social and emotional data interact during an eligibility determination? And would it be possible for you to break that down for families for them to know the difference?
Sure.
And maybe that's something that they can ask for?
So these are all areas that I would always consider under any evaluation. Just like I said, there is a framework that we generally work under, and I'm always assessing cognitive abilities. I'm always assessing their academic performance. Social and emotional is very important. And then behavioral, if there's components like a functional behavior assessment, that would be part of the evaluation as well. So all of these things are part of my, let's say, test construction. I will use different measures based on the individual, but overall, I am looking at all of those areas for all of my evaluations. And really how they interact with each other is, let's take the example of specific learning disability. Let's say the referral question is, does the child have a learning disability in reading? The cognitive and the academic achievement is going to be one of the highest things that I look at, because I'm using my test instruments to tease out and see if the child has what we call a pattern of strengths and weaknesses. So that's one way that people determine what a specific learning disability is. And if this child has that, I would use my pieces of my cognitive assessment along with my academic assessment to determine if there's a pattern that the child is displaying a learning disability. Oftentimes when it's a reading disability, I'm looking more at their language skills, their oral language skills. I'm looking at the underlying factors that contribute to reading, things like rapid naming. That's one of the cognitive abilities that I will generally do, because that is a huge determination, that skill. Oftentimes dyslexic individuals have difficulty with naming and rapid naming. And so all of those things I will use to compile determination. And then also, I always look at the social emotional factors, because no matter what, if a child's having trouble reading, let's say there's times where there's no difficulties in social emotional functioning, but there are times that there is, that I would just use a screener for my social and emotional functioning, or I would use a more comprehensive battery if there were behavioral difficulties. So that's kind of like an example of how I'm looking at those areas too, and how they interact with each other.
I remember the first thing you said is it depends on the referral.
Yes.
Damn, that's why it depends on the referral, because then you're like, this is how they would interact, and then this is where you would give more attention to one over the other. So
let's take another example, because I think there's different examples. Let's take, for example, I had a psychologist call me the other day, and she said she was assessing a student who is in a typical life skills classroom. So performing lower cognitively and academically. When we give our assessments, we're using the assessments to compare that child to other children their age on a national level. And oftentimes what I find with students who are multiple grade levels below where we're comparing them is we're getting lost in the numbers, and the numbers aren't really describing the child, if that makes sense.
Yes.
So for situations like that, what I have said to the psychologist and what I've done in the past is I'm going to rely more heavily on the input from the teacher. So the special education teacher that's doing the functional skills in the classroom, the IEP goals, that type of data is way more important in that evaluation than any score I'm going to give you. It's my scores don't give that. I can make the eligibility determination, but it's almost like we already know that information. We want to know how the child's progressing. And I think that's where I do a little different of an assessment, because we don't capture the true progress in just the numbers.
Can I ask? I remember for one parent really wanted to do another assessment, the whole comprehensive assessment. And the psychologist was like, there's no need. He is, I believe he was 13 years old. He's at the age of 13. I think that he said something like, by the age of 8, you don't really see much changes there. And I think it's because he was on the bottom part of the slope of the bell curve, and that he was like, we're not going to see anything there. Therefore, we're not going to have another assessment. But mom was like, but his behaviors are finally more, where she would be controlled. He's like paying attention more in class. Yes, he may have every now and then a little bit of an outburst here and there, but it's nowhere near the assessments that were done. I think the last time it was done 3 or 4 years ago. But he was just pretty adamant about there's no need. We already know that he is eligible. But mom is like, I know, obviously he is eligible. My question is, I want to know how much he has learned. Where is he currently at compared to his peers? But the psychologist was like, this is an eligibility meeting. He does require services. He is eligible for social education services. That was the whole point. But mom was more like, I want to learn something from these reports. What would you say about that?
I understand. Situation? So I think that I can see both sides. And what we have to remember is the purpose of the reevaluation is to determine eligibility. So that's what the psychologist was saying to the parent. We have sufficient information to determine eligibility, and likely within the school setting, within that scope, that the psychologist can provide that service. If they have enough information to determine eligibility, they're not going to do that additional piece that maybe the parent would like to have. Parents also have to remember that oftentimes, if they're performing on the lower end of the bell curve, those cognitive scores, again, are not really a good depiction of progress for their child. Because if you think about the bell curve and how many children are within that scope, if you're performing within the lower end of that, that would be typically where you would be performing for years of your life. Not saying that there isn't a chance that the child will make progress. That's not the point. But the standard scores are not sensitive enough to show
That's a good
that
word.
mom.
Sensitive enough.
Yeah, it's not sensitive enough to show mom where that progress has been made. So again, that's where I would turn. If I was at that meeting as a psychologist, I would say, we have information about eligibility. That's not the question. If you want to know about progress, let's look at the IEP goals. Let's see what your child's doing day to day and where we are in those things, because that's going to be more sensitive to progress.
So you would say, because I've noticed that there has been more parents of children who are on the certificate track where the psychologist is more like, there's no need, there's no need. But if their child is more on the high school diploma track, I do see that they are inclined to want to do that, even if it's their last year. I've seen this a lot. It's their senior year in high school, but the parents are asking it so they have something to give when they go to college.
So I worked in a high school the last 4 years. I am not always doing a cognitive assessment for my kids in high school. I'm not, because generally by high school, your intelligence is relatively stable. And if you've had 3 or 4 cognitive assessments throughout your special education years, there's really no more information that's going to tell us. So in high school, I do focus more on academic achievement. But I will say, if my student coming to me has an autism diagnosis or an intellectual disability, I am always assessing cognitive functioning. I'm always assessing academic achievement, and I'm always assessing adaptive skills, because when that child graduates, that's the document they're going to use to try to get state services. And states are looking at those specific areas.
State services.
Yes, not all families have the ability to hire a private psychologist to do an evaluation for them. So with that in mind, as the child gets closer to graduation, if they have those diagnoses, autism or intellectual disability, I'm always doing the cognitive, the academic, social emotional, and the adaptive raters. And I tell us to the parents, save this evaluation. You will need it when you apply for services for your
adult
child.
Services.
Yep. So I think, again, it depends on the situation, right? But we as psychologists should always be thinking about that for families. We should know when it's appropriate or maybe not appropriate to do the assessment. And especially as the children get older, we want to make sure that we're giving families what they need for the child's next step.
So for this child that I was telling you, the one that was certificate track, that he was like, no, there's no need, it's too low. But for him, his senior year or junior year, whichever year he falls on, then that would be a good time for him to have that evaluation done, or for the parents to request. Then maybe he should be more inclined to say yes at that time.
Yes, depending on your state. So yeah. Also, it's important for parents to know what the state disability office needs to determine if their child has a disability post-secondary school. So some states require you to have an IQ test and you to have your adaptive scores from a psychologist. And some of them require within the last X amount of years. So you want to be informed about what assessments are done, because when you go for that meeting, they're going to send you a permission. You want to have a conversation with, I want to apply for disability when my child graduates, and I want to be able to use this evaluation. So if you could please complete the cognitive as part of that, because the state's going to require me to have that. And I think anybody would understand that's a reasonable request at that point. So I would hope that within that discussion, the psychologist would understand the importance of that assessment at that time.
You're right. And it also goes into guardianship. It just depends if they're going into that route, or if the parent get that obviously they have to talk to more professionals, medical professionals, but at least the professionals doesn't have to go into a blank canvas. They have reports that they can read and then they can see it, and it'll be a faster transition, I guess, to adulthood. Because I know
Right.
the guardianship part, from what I hear, my daughter's turning 18 next year, so I'm like, I'm so nervous.
You have to be prepared.
Yes. So you're also giving me ideas and also telling the other families, okay, this is how we're going to get our documentation on set. Like,
Yeah, I
good to
think
go.
that is a really important thing that I don't think schools do
Mm-hmm.
well enough in preparing families
Preparing.
for the transition.
Yeah.
And it can be really rocky if families are not prepared for that. Because if you think about it in the sense of that, my child had special education services for 21 years of their life,
Yeah.
and now the school's like,
No
okay,
more hand holding. You
bye. You know,
can't call the school anymore.
how difficult that transition could be.
Yes.
And also, in most states, families can register their child with the state disability office before they graduate. So that's
Mhm.
another really important part of transitioning, is already having that relationship with the disability office. So that's not something that you want to do as your child's a 12th grader. That's something you want to do in middle school.
Well, actually, Aaliyah, we signed her up for adult services. It was DDA. We actually didn't know it was for adult services. We were told to sign up, and we were signed up there like, yeah, she's found eligible. She's going to be on the wait list until she turns 21. I was like, oh, okay. I didn't know, but I believe she was around 5 or 6, and they already determined her. Well, she had 5 brain surgeries. She has history of it. But at that time, her seizures were so severe. But yes, that's how I knew. We were signing up for different waivers for her in this state, and none of them were open. So then they were like, maybe her case might be deemed eligible. So just in case, sign up if these other waivers don't kick in first.
Okay,
So
yeah.
that I didn't know it can be that early on. But yeah, she's on the waiting list. But we don't have to do all that madness when she is 17. So I'm excited.
That's good.
Yeah,
That's good. Because there's other things that you're going to need to focus on when she's 17, when
yeah,
she's 18, when she's 19. So,
like the guardianship.
exactly. Yeah.
Yes, thank you. But sorry, going back to these, what happens when test scores, they look average, but parents and teachers are reporting significant daily struggles?
So this is always complicated. So I just had a situation like this. So I'm going to explain to you this situation.
No, I
And
love examples.
yeah, I work in my own private practice. A family has hired me to do an evaluation to determine if their child has dyslexia, and also if they have attention deficit hyperactivity disorder. And there's been no problems reported from the teachers, nothing. She is average. When I tested her, she is average academic functioning, 12-year-old girl. So, whereas she has a disability that I find out through my evaluation that she does have inattentive presentation of ADHD, and she also has a generalized anxiety disorder that I found through the testing. It's not impacting her academic performance based on her teacher's ratings, based on the tests that I give to measure her against her other peers nationally, and based on her grades. So that would be a case where maybe the child does have a diagnosis of some sort, but at this point, she would not be eligible for special education because she doesn't have that impact academically. And so some of her social and emotional rating skills have come up as elevated, which would indicate that she has a disability in that area, but it's not impacting her to the level that requires special education. Does that sort of answer the question?
Oh, yes. Yes. So I belong to different parent groups. And I feel like I learned so much from these because since Aaliyah was very little, early intervention, remember, she's almost an adult now. She's going to be an adult next year. But I've been in these different groups. And I remember once it's like she knows her daughter has ADHD. I think she graduated high school. I think it was maybe 3 years ago. Then one of the things that the mom was saying is, I just can't take it. I just can't take it. There's a lot of us families that are just like, okay, we're just so overwhelmed. She's like, if I have another science or another math, because she's sitting down with her child. And it actually happens to a lot of us. Like we're doing the work with our child. I know with me, English is my second language. So I know my parents couldn't help me, but my cousins or my neighbor, I remember once helped me to understand a little bit more what was going on. But this one, she kept on going to these meetings because she's trying to have her child be found eligible for an IEP because she was like, I'm doing all the work. She's really worried about college. And she's like, I hope my child does not go to college because she's just gonna.
Yeah, she doesn't
Yes.
want to go to college either.
No, she does not. She was like, I have to find a job for her. Or at least she talked about maybe having a gap year. But I understand. But the amount of stress that this mom was sharing, I felt for her because she's a single mom working full time plus another part time and then still finding the time to be a mom for her child. And this question reminded me of that. And one of the things that we were telling her is you just need to step back and let the teachers be the teachers. And then she was like, so you want me to allow her to fail? And we're like, no, not that either, but actually maybe yes, but they have to see all the struggles that you're seeing at home because they're turning in homework. And then mom is like, yeah, because of me.
Because I turn it in. Right, exactly.
We're doing it together. Without me, there is no homework. So they're not seeing that. So that can be also another factor that I think what parent wants to let their child
No
fail?
one, no one. And I don't think anybody should, be at that point, unfortunately, but that's the way our system is, right? You really can't get services until you're performing well below your peers and you show that educational impact. It's unfortunate that we work in a system that requires a child to be in the place of failure before we can provide interventions, because what we do know about good interventions is that we do them early and as soon as possible.
Yeah.
Right. But unfortunately, the law states the child has to show that educational impact.
Yes. Yes. I remember my son has a speech delay and he wasn't found eligible. And during the eligibility meeting, I was like, Mom, because you're doing all the great things. I was like, but what if I wasn't here doing all the good things? And now my son is in kindergarten and then the kindergarten teacher, we're supposed to have a meeting this week and she is seeing the impact in the classroom, but I was trying to get eligibility before.
Right.
Like, I'm trying to be more of a trying to
preventative. Yes.
Yes, because I've been seeing my son, like I see my son, I want to secure him away from having that low self-esteem. It's like, oh, is it me? I'm like, man, it's not you, baby. It's not you. So I know that all of us parents are trying to help our children have that high self-esteem of them.
Sure, sure. And part of that, I'll say, it's good for kids to also have resilience. So
that's true.
To have some challenges in their lives is going to be a very good lesson for them to acquire some good character skills. And I think we sort of forget about that. We forget in this world of quick technology where people acquire things so quickly that a little bit of struggle is the way that you build your resilience. But there is definitely a fine line between gaining resilience through challenges and failing.
And feeling like a failure.
And feeling like that, your self-esteem is impacted. If you're going that route, and for speech, OT services, those types of supports, you might be able to get outpatient supports medically through your insurance if the option is not available for school services. So that's also something parents should know, that maybe to pursue it from a medical standpoint might be a good way to try to do some preventative measures.
Yes, thank you for that. You said a lot of things that are very beautiful though. But thank you so much for putting that out there. I remember a parent once told me, yes, we can get OT, we can get speech, but how come we can't get special education, like special education tutors?
Tutoring, right.
The tutoring for special education, if we tell them that there's an IEP, it turns out to be from maybe $20 an hour to anywhere now from 80 to 150 an hour. This county.
For sure.
Tutoring is very much different. So we do try to do more of the speech and OT to help us with certain goals. But one of the things that I wanted to ask, which we were talking about a little bit earlier, is How do they interpret the educational impact when a student is passing the grades, but they're not accessing the curriculum?
This is like another one of those, we have to ask more questions.
Mm-hmm.
Okay, so we have to figure out exactly what's going on in that aspect.
Can I describe this question maybe
I would love
better?
that. Yeah.
So, okay, maybe I should describe this question because let me explain this question a little bit better. Let's say I am mom to a child that has ADHD and I'm checking in the book bag. It's disorganized. I don't think he's ever looked in there ever, and no homework is being done at home, so I don't really see much of that going on. But then I see the grades, it's very much A's. You're seeing A's or even B's. You would be like, there's something going on here. And then when you do ask your child, hey, what did you do in school today? Nothing. What did you learn today? Maybe nothing you have heard. But then all of a sudden, the grades don't really reflect. And then you're questioning if your child is actually accessing the curriculum. Are they really learning, or is it more like babysitting?
Right. Is there something else going on? So we want to ask all of the questions as parents. We want to understand what the child's going through in school. I could see this happening when maybe a child has special education services and either the teachers modifying the curriculum to the extent that the child can maybe easily access it. So maybe changing the assignment or counting or grading differently because the child has an IEP, but we know as the parent that the child hasn't really gained that skill and doesn't really understand what that skill is independently. So I think that's where we have to understand the process that the teacher's taking to grade things and what they're doing to modify it and how it's compared maybe to another student in the same class. So we can understand sort of the viewpoint of the teacher, because grades are rather subjective at some points. Some of them can be objective. The teacher will use their discretion at times to make a determination on grade. And oftentimes, if a student has an IEP, we're not supposed to, as educators, fail the student. So the grades may look different than a student who doesn't have an IEP. So again, I think just having that conversation with the teacher and the school team will better be able for the parent to understand what's going on and also make adjustments based on both perspectives and how they can move forward and understand that the reflection of the grade is to indicate XYZ and might not indicate full acquired skill per se, but it might be more of a reflection on their modifications in the IEP.
Yes. I think this question typically comes up, especially when the parent track that their child is going to go to college, but this is not typical routine of a child that is a student that is about to go to college or planning on going to college. So we just want to make sure that we get them ready for college, but getting ready for college means you have to study what you learned at school after school. So I think that came from that mentality from over there.
Yeah, asking the questions, being involved, coming from a place of trying to understand what's going on and what you can do at home to help. And just coming from that place of I'm just trying to understand where these grades are coming from so I know what they mean to me. Mm-hmm. But yeah, again, I don't think we do well enough as educators to also prepare students for the transition to college. I think there's a huge jump, you know, especially for students who have IEPs, because they won't have that IEP in the college setting. They might get some accommodations, but they might not realize how much support they had until they're in that college setting.
Yeah. That's why a lot of times I tell the families they have a lot of support. Maybe let's start them off as part-time. Maybe not so much full-time right now. Let's see how she does. So it just depends, right?
Yeah, it does.
Okay. My next question is, can you please speak of the dangers of over-relying on scores alone without considering the functional performance?
I think we touched on this a little bit when I was talking about the student that another psychologist was evaluating that was in a life skills classroom. But those are the instances where I don't rely heavily on scores and I rely more on the narrative and the observations from the teacher, because I find that the scores don't do the child justice. And like I said, they're not as sensitive to the progress that the child may be making. For an adaptive assessment, let's say, where we're looking at daily living skills, the parents and the teachers generally fill out those rating forms that will compare the child's daily living skills to other kids their age. Let's say 3 years ago, the child's adaptive skill score was a 72, and now 3 years later, it's a 75. That's essentially the same number when we talk about standard scores. That's not telling us that the child's acquired 17 different functional skills over time. So that's where I say I'm looking more at the narrative and the observations from the teacher. I wouldn't say it's an underrepresentation of a child's performance, but it doesn't capture the progress that we have seen in 3 years.
Yeah.
A 71 is 75. It doesn't really mean much.
Yeah. Okay. Thank you for that.
Yeah. Does that make sense?
Oh, yeah. Yes. I think we just shouldn't rely on just one, especially if we're trying to capture.
Exactly. And especially for kids that we are looking and working on their daily living skills in school. So we're going to have a lot of information about their adaptive skills that will be more representative of their present levels using the observations and other things compared to the instruments that a psychologist would use typically.
Yeah, I remember that there was a situation with a family just being really stuck on these cognitive scores and how they don't see the improvement. So they're just stuck on this. But you're right. We shouldn't rely on just that. My daughter's on certificate track. So I've learned, I was told very early on, just don't even look at those. Meaning don't look at those as, don't get stuck on those. The ones that you have to focus on is over there. It's just like
one piece of information. You already know a lot of these things. You already know
how they're performing compared to their peers.
Yes, exactly. You already know that. So the score isn't telling you much.
Yeah. Yes, just how they are compared to their peers. Thank you for that. I just wanted to make sure that our families do understand that, because a lot of the times, hopefully, like I was told early on, but I'm just nervous that other families aren't being told early on, and they just see these scores and they're like, oh, this is the consistent one. Let's compare one to the other.
It is so confusing, right? And if you're not familiar with these types of tests, it's very easy to, as a parent, be very concerned or worried about, why is my child not making progress after 3 years? When in actuality, we do see progress, just not particularly in the assessments that are given by the psychologist every 3 years. And that's why we do a comprehensive evaluation and we include all the IEP progress, because we want to get a really comprehensive picture of how each individual child is making progress, to make sure with those reevaluations, one of the things we're checking for eligibility, but we're checking to make sure what we're doing is the right thing for that child.
I remember those meetings where they're just really stuck on one. I'm telling you, you really do have a gift about breaking things down. I think there's so many notes that I'm taking down, and I wrote specific names for certain families. I'm like, take this clip and send it to this mom, send it to this mom for this clip. It's just how you have been describing these. I know that you have to leave soon. I'm so sorry. Can I please ask you 2 more questions?
Of course. Yes.
Okay. So have you seen cases where a student clearly needed support but was found ineligible due to rigid interpretation of data?
I really have not. I think more often than not, what I have come across is if there's a question about eligibility, it could go either way. Let's say not eligible or eligible. What I do in my practice is err on the side of caution. And so if I feel like it could be a 50-50 split, most likely I will make the child eligible. Legally, generally, you don't get in trouble for giving a student more help. You get in trouble when you're not giving them enough help. So if I see a 50-50 split like that, where I feel it could go either way, and I'm making it the determination, I will go towards the eligible. And I generally don't see a lot of rigid interpretation, but if I did, it generally is more with school psychologists who are more new to the profession. But I would say overall, school psychologists are really well trained in those test measures. And generally, I don't see a lot of very rigid interpretation. The rigid interpretation that I see is the stipulations that the districts put on the psychologist.
Yeah. Yes.
Right? So the cut score, or you have to have a 70, or you have to be 2 grade levels below. That's all stipulations that maybe a leader in a school district will put onto the psychologist. And that tells me they don't truly understand the art to interpreting the tests that we give, because there's really no hard and fast score that we could give. Most of our tests and the time it takes us to do evaluations, there are so many test numbers that it's hard to make that interpretation just easy. So I think the rigidity comes with the school system and the school districts. I don't see it a lot from the psychologist standpoint.
Yes, I was in an IEP meeting where the psychologist was like, I was a former school psychologist for 30 years. And then at that time, she was the advocate for the family. And she was just letting the school psychologist know what you have determined doesn't beat her experience. So when you were saying it may be because of the experience, I remember that exact one, how they just contradicted each other, even though they both worked in the same county. It just has a lot to do with experience. And the psychologist was basically saying she can see if they're going the route where they were trying to go, it's only going to decline. So she's trying to prevent that because of her 30 years of experience working in the school system.
Yeah, I think we get better with those types of things as we get more experience. I know as a new school psychologist, you don't know what you don't know, right?
Yeah.
So by experience, you really do acquire a lot of skill and in the interpretation and the foresight to know what could potentially happen. The jobs that we have in schools are really important. We're making determinations and decisions for children's education that will affect them years beyond us. So I think that I think as you get older, you are more familiar with the importance of the decisions that we make and feeling comfortable making those clinical interpretations and foresight to know that your decisions at that table will impact the child for the rest of their life, potentially.
Thank you for that. Because I know we're short with time. In your experience, which eligibility category are most frequently misunderstood or misapplied by teams?
So we talked a little bit about this too. I think emotional disability is such a general classification with very general description and interpretation, and then also a negative connotation. That's like the first thing that comes to my mind is that there's a misunderstanding perhaps about that classification because it is just very general, right?
Yeah, there was this one team that didn't want to do the autism. They're like, he's not acting autistic. And the mom was like, but he has an autistic diagnosis. But I think it's just the way they said it. And mom was like, why are you saying it a certain way? Didn't we just fill it out? And they says like he is eligible to be in that category.
Right? And I think there's misinformation maybe about what autistic looks like. Maybe that's another misunderstanding that teams don't understand that it's not one size fits all. There's a whole spectrum of autism, right? And that's like that for all disabilities, really. There's a whole spectrum of people that are intellectually disabled. There's a whole spectrum of people that are learning disabled that
just
have
how much
ADHD.
It impacts their education.
Right. And that can change over time, right? So maybe they're okay in 3rd grade, but as they get to 6th, 7th, 8th grade, they're really struggling. And that's why it's important to have that consistent communication with the school to make sure that you understand how your child is doing. Going back to the grades and things like that, the number one thing I would say to parents is just being consistent communication with the teacher is really important. And it's your right as a parent to have that communication too.
Yes. I'm so sad that was my last question, but I need more families to follow you, talk to you, because I feel that this conversation was so friendly, as in not friendly, you're nice. Yes, you're a very friendly person, but how you deliver information, I want to say that it's a talent that you have. So I
Oh,
really do
thank you.
appreciate you for
Thanks.
just breaking things down. So how can families find you? And if families are looking for services, can you please tell them how they can
Yes,
work with you?
absolutely. Yes. Like I said, I'm a licensed psychologist in Pennsylvania and Delaware. I am also part of the PsyPact, which is a credential that I have that will allow me to provide telehealth in over 43 states. If you want to get in contact with me, the best way is visit my website, delcopsychservices.com. And there's little tabs at the top, and one of them is Contact Dr. Mathews. So if you click that link, you can fill out that form. It will come directly to me, and I will be in contact with you within 48 hours. That's my best attempt to get back to people, at least just to schedule a consultation. So I offer a 15-minute consultation that is free to make sure that I'm a good fit for the family and to see what services they may need. So that's where you could find me.
This is great. And we also do have a part two. I think
We are
maybe
doing part 2 on Monday.
okay, so great. I'm excited
Yeah.
for that one. So
Okay.
excited for this one too. So thank you. Thank you so much
Yeah.
for all that you do. So what a powerful conversation that was. Thank you, Dr. Mathews. She did such a beautiful job breaking down eligibility in a way that feels accessible and not intimidating, right? I kept on saying during the interview how amazing she was with these explanations. It was very friendly. So here are a few key reminders from today. A diagnosis alone does not equal an IEP. Educational impact is the deciding factor. Reevaluations are about eligibility, not always about showing growth through standard scores. Let's not forget that functional performance also matters, and transition planning should start earlier than most families actually realize. And actually, the most important is that your voice as a parent matters in every room that you step in. If this episode gave you clarity, encouragement, or language that you didn't know that you had before, please take 30 seconds or less actually to follow the podcast, share the episode with another parent or educator, leave a review or comments. I read every single one. And if you want deeper support, please visit us at www.startingwithiep.com, where you can access our courses, download free resources, join our community, and learn how to confidently advocate for your child. And if you need private consultation support, remember that Dr. Mathews can be reached through her website at delcopsychservices.com. And also, please know that we do have a part 2 coming up with her because she is just that amazing. So you don't want to miss that. So until next time, keep asking your questions, keep advocating, and please remember, you know your child's best. I'll see you in the next episode. Bye.